Raise your hand if you go to the doctor frequently to get a checkup. Okay. Now, raise your hand if you generally feel safe whenever you get a checkup with your doctor. Okay, so I see that a few of you at least feel generally safe around your doctors. But I'm here to tell you today that this is not the case for everyone. According to GLAAD.org, transgender people live in poverty at 4 times the national average in the US. 19% report lacking any health care whatsoever, including Medicaid, even though Medicaid is supposed to help all low-income citizens access health care. In addition to financial constraints, even those who do have access are at risk. In 2013, a survey was conducted of transgender individuals, and they reported that doctors would deny them care, they would deny them care or treatment after they revealed that they were trans. The participants also reported that they avoided seeking treatment to avoid exposure to discriminatory behavior. Clearly, there exists a culture of implicit bias in healthcare facilities, and it's extremely dangerous. An implicit bias test was conducted in healthcare facilities with heterosexual, gay, and bisexual healthcare providers. Heterosexual healthcare providers obviously showed preference for heterosexual patients, and nurses showed the strongest preference. 42% of males and female adults have been confronted with verbal and physical assault or have been refused treatment altogether. What is the point of a healthcare facility when only some patients get to feel safe? Why is safety and hospitality a luxury that only cisgender and heterosexual individuals get to enjoy? One of the most dangerous things to be present in a healthcare facility is a lack of understanding of your patient. So I'm going to clear up some misconceptions surrounding trans patients. The most frequent one is that being transgender is a mental illness. According to the National Library of Medicine, gender nonconformity has been considered a mental illness up until very recently. The problem with this perspective is that it implies that trans and gender nonconforming individuals are broken and need to be fixed. The idea that those who don't subscribe to the gender binary, which is mostly a construction of Western societies anyway, must be mentally ill is oppressive and limiting. However, many trans and gender nonconforming individuals do experience gender dysphoria, which is distress caused by one's assigned gender at birth, in this case, which does not coincide with their gender identity. Now, who here is aware of the term pro-choice? Who here knows what pro-choice means? No? So basically, pro-choice means that, like, if you're pro-choice, that means that you advocate for people to have access to abortion with little to no restrictions. So who do you picture when you think of reproductive rights and pro-choice? Do you think of cis women, men? Most people think of cisgendered women wearing pink hats and marching. But if you didn't know already, cisgendered women are not the only ones who are fighting to control their bodies, and they deserve to be recognized. Trans and non-binary people need access to abortions, clinical access, and birth control too. Now, does anybody recognize this person? No. Well, this person is a non-binary transformative speaker and Boricua, Jack Kemi. They wrote an article describing their experience with the pro-choice movement. They write, "The war on women is a war on me, but I'm not a woman." Kemi continues to explain that it feels almost hypocritical to be part of a movement that does not acknowledge you, and they're right. Over 1 million trans people are reported to be living in the US, and millions more are gender nonconforming. If you can't be proud of a country that doesn't acknowledge your existence. You can't be complacent in a system that insists that some people do not deserve to have their existence acknowledged. So, the next time you talk about women's rights or pro-choice, remember that it's not just cisgendered people or cisgendered women that are at risk here. Thank you.